Hello and welcome to Flinders University. I'm Associate Professor Pauline Hill and I'm the course coordinator for the Bachelor of Nursing. I was also a student here at Flinders University when I first learnt to be a registered nurse. After that time I went and worked at a major metropolitan hospital. I taught there, I've taught elsewhere, I've been to conferences overseas, I've taught overseas, and I've had an amazing career actually. I've enjoyed every minute of it and I would highly recommend nursing. Nursing and midwifery are two individual professions but often related. Many people are nurses and midwives, some people are nurses, some people are midwives. You can do each of them individually or you can do both. I'm a nurse, I'm not a midwife, but many of my colleagues are both. They're both amazing professions. They are fast-paced, they're interesting, there's never 2 days the same. You get to work with people at the most important phases and stages of life, right from conception through to birth, right through to old age and everything that happens in between. You can do it here in South Australia, Australia, anywhere in the world. And this degree helps you to do that no matter where you want to go with your career. You can do nursing in a whole range of areas and spaces, more than just a hospital, but community health settings, GP practices. It can be in people's homes. It can also be in the armed forces. Lots of places employ registered nurses. And there's lots of areas that you can work. You can do your undergraduate degree and then go on and specialise into areas that you may be interested in. Or perhaps you'll be working somewhere and recognise you want to do some further study. And you can do that with us here at Flinders as well. A career in midwifery is much more than birthing babies. You'll be doing a range of things from conception through to antenatal education and support, working with women when they deliver, during their pregnancies, post-delivery, and helping them to manage the brand new baby in those first few days. It's an exciting career that can take you around the world, and lots of areas employ midwives, not just hospitals. When you complete your midwifery qualification, you can go on to further study, whether it be in education, clinically, management, leadership. It's a whole range of things that you can do and advance your career with specialisation in midwifery and other areas as well. Flinders University is a leader in health and care, in nursing and midwifery. We've been doing nursing here at Flinders University for over 40 years and midwifery for over 15 years. And in both professions, we were early adopters for direct entry degrees in both of these degrees here at Flinders University, in fact leading the nation in this area. Both the Bachelor of Nursing and Bachelor of Midwifery are accredited with the Australian Nursing and Midwifery Accreditation Council. Our graduates are able to register in both of those professions with the Nursing and Midwifery Board of Australia. Our course has to be accredited and all of our staff who teach in the course are all registered in those professions as well. Both the Bachelor of Nursing and Bachelor of Midwifery have placements as part of their course. We have great relationships with our industry partners, both here in South Australia, in the rural areas, as well as interstate. We also undertake placements in the Northern Territory through our Flinders NT sites in Alice Springs and in Darwin and in some of the remote locations. We also offer some global opportunities where we apply for funding and we have groups of students who travel overseas, Vietnam, China, Indonesia, and undertake experiences there and sometimes placements too. We have staff who work really closely with our industry partners and in fact some have shared or joint appointments between the university and those places. The Bachelor of Nursing is also offered at our Renmark campus, or Riverland campus, we sometimes refer to it as. It's exactly the same program and we have a small cohort of students and staff who are there full-time at the Renmark campus. Here at Flinders University, we have amazing state-of-the-art laboratories. In those laboratories, we use a range of what we call low fidelity and high fidelity equipment. We have mannequins. Sometimes we use the high fidelity simulation where the mannequin talks back to you as a student and tells you that they're feeling unwell or they moan or groan or sometimes their heart stops and you have to know what to do. We also have a mother who can give birth for those of you doing midwifery and knowing how to manage that. We have a HoloLens, which is an amazing piece of equipment that enables you to look inside the human body and see the nerves, the arteries, the blood vessels, the heart, and really understand how the body works. We also have a staff member who dresses up, makes out they're an old man, even though she's actually quite a young woman, and she will walk around in amongst the laboratories and talk to you as if she's one of the clients that you're looking after. So you better be ready for that. You never know when it's going to happen. When you're in the laboratories, it's an opportunity for you to practice what you need to learn before you go out on placement. So we try to make that as real, or simulated as we say, to the real thing as possible. That gives you an experience and then the confidence and the competence for when you go out on placement. The Bachelor of Nursing and the Bachelor of Midwifery are offered in a combination of on-campus, online, sort of education where you can read things prior to coming to class, and then you can do things in a classroom together, you can do them in groups, you can do them in the laboratories, and that's both here at the Bedford Park campus and at our Renmark campus for nursing, and here at the Bedford Park campus for midwifery. The teaching is flexible and suits a range of learning styles. And we often refer to the flipped classroom, where some things are done in a classroom, some things are done at your own home, where you learn and then come back to the classroom to discuss with the tutors, with the other students that are studying with you, and you share your ideas and your understandings to really clarify, to make sure you're comfortable with your learning before you go out on your placements. Both nursing and midwifery are highly respected and highly valued professions. That's because of the ethics and our code of conduct and our professionalism. They're the sorts of things you'll learn about in the courses, and the sorts of things that you'll see role modelled by the staff that are teaching you and the staff that you work with out in the field, wherever that may take you, on your placements. One of the great things here at Flinders is that we're a big team. We work together, we work in teams, because nurses and midwives work in teams. You'll get to know the staff, you'll get to know each other, you'll form lifelong friendships. In fact, some of the people I taught are now my colleagues. I still have lifelong friends from when I very first started as an undergraduate student nurse, quite a long time ago. So, if you're the sort of person who likes to help people and you're curious about how the body works, then maybe a career in nursing or midwifery is for you. Thank you for visiting Flinders University, and I look forward to welcoming you here on campus soon.